Hello, everyone. Thank you for joining. We are glad you are here with us today. We'll give it a couple of more minutes, just allow individuals to join. I see more people coming in. Awesome. All right, well, let's get started. Hello, everyone, and thank you for joining us today for the Kansas Community Collaborative to Prevent Infant Mortality State Town Hall meeting. We are so glad you are here. We will get started shortly. In the meantime, I just want to go over a few things. This session is being recorded. The recording link and slides will be shared following the webinar. All participants are muted upon entry. We ask that you remain muted to limit the background noise, and we encourage you to share comments using the chat box and questions using the Q&A box. Next slide. We have an exciting and full program where we'll learn about the role of CCHI with KBEN in advancing birth equity in Kansas, maternal, paternal, and infant health in Kansas, the community in CCHI, as well as the Ohio Collaborative to Prevent Infant Mortality. Next slide. I would like to introduce Dr. Sharla Smith, founder and executive director for the Kansas Birth Equity Network, for our welcome introductions. Thank you, Dr. Smith.
Thank you, DeAndrea. I just want to welcome everyone on behalf of the Kansas Birth Equity Network, and NICHQ welcome you as we begin to honor this launch of the initiative for this state town hall meeting. Today, we are gathered as a community of advocates. We're gathered as healthcare professionals, policymakers, parents, researchers, and most importantly, we are gathered as voices that directly impact inequities in maternal, paternal, and infant health. This town hall is not just a town hall today, guys. This town hall is a call to action. It is an opportunity to bring together diverse perspectives, shared lived experiences, and identify solutions that moves Kansas closer to equity in birth outcomes for all. We are here to listen, learn, and collaborate. We're here for true partnership in the sakes of making sure that we have healthy moms, dads, babies, and birthing persons. We recognize that dismantling systemic barriers requires collective effort and collective action. No single organization, clinic, or community leader can do this work alone. So by coming together and starting today, we can build partnerships that create sustainable change that ensures that every birthing person, every mom, every dad, every baby, regardless of race, zip code, income, education, has access to respectful, culturally appropriate, high quality, and responsive care. So join me today as we launch this effort to come together to make true change. And joining me to make the true change are none other than friends and champions and true change agents, Dr. Stacy Scott, Michelle Edison, and Dr. Nikitra Burse. So grateful to be here. Welcome, welcome, welcome.
Thank you, Dr. Smith. Now we will take a moment to hear from Dr. Stacy Scott and the role of CCHI KBEN in advancing birth equity. She's also the Vice President of NICHQ.
Hello, everyone. It is great to be here. I want to make sure to know that I'm one of the vice presidents here at NICHQ and welcome this opportunity to be able to bring together these wonderful group of experts and really, again, be able to share with you exactly what CCHI means and what it stands for. And so I am looking at the chat box and very excited. Thank you. Continue to check in. Please put your name and your organization you're from in the chat box as we continue. If you can go to the next slide, please. So again, want to give you a little background about NICHQ. We are an organization that envisions a world where in every community is filled with realized power, leads transformative efforts that achieve optimal health for mothers, birthing families, and infants. Next slide, please. And of course, as you hear us say CCHI, which means Community Centered Hospital Initiative, we aim to create a roadmap. Again, we are working with communities and willing communities to take the lead. Again, being able to collaborate, and our main focus is that of hospitals and perinatal quality collaboratives across the country, but most and foremost is communities and being able communities to help realize the power they have in, again, optimizing health for all. Next slide, please. And so for us, the future is now. And if we can go to the next slide. And what I mean by that is that we are encouraging communities to be proactive in creating a better future for our communities, for our families, and we're working together to save lives by learning from the past. We are working in the present and positively impacting the future. Next slide, please. And so we are creating a roadmap, and you all are part of our journey as we create this roadmap. And again, we want this roadmap to lead to success. We are looking at, again, how we define success, not just in the terms of output or metrics, but including trust, centering community voices, enabling transformative change, even if that change is gradual and requires persistent, thoughtful navigation of challenges. And ultimately, we are looking at innovation. We're looking at community-driven strategies that will help us develop and help contribute to our measurable improvements in maternal, pregnancy, and infant health outcomes. Next slide, please. And so with that, we say we are using our radical imagination. We are working to address complex systemic issues that require a willingness to step outside of our traditional way of thinking. You know, we're pretty good about thinking linear, so we are now looking at how we can expand our thought, how we can build trust and create psychological safety, also within our teams as well as our external partners, and really being able to be flexible and open and really contribute to what is needed to have this type of transformative work. Next slide. And so what does that mean? We are stepping outside of the confines of the now into the expansiveness of what could be. Next slide. And so with that, I'm going to turn it back to my dear colleague, Dr. Smith.
Thank you, Dr. Scott. Next slide, please. You may be asking yourself, why are we here? Why now? Why Kansas, right? Well, part of the reason that we're here is because this emerging need for maternal health and improvements in maternal mortality and morbidity is a national issue. We see that in the US, maternal mortality, the highest rates come from mental health. But when we look at this overall in the last 20 years, we see major impacts on cardiovascular disease, hypertensive disorders, and other disorders related to stress on the body. And so Black women are weathering in our United States, and that is only becoming more emergent of an issue for us to address as we move forward. Next slide. So in Kansas has the highest Black maternal mortality rate in the first 42 days after birth in the nation, which makes us number one in that. And because of that, Black women and birthing people in Kansas are 5.8 times more likely to die from pregnancy-related issues than white birthing people. The realities of this is that we must do better. If you're looking for the solution is you and I, and we must make a change. Next slide. Mortality in Kansas. For over 30 years, Black infants in Kansas have been dying at 1.8 to 2 to 3 times higher than white infants for over 30 years. So what does that mean? That means that while infant mortality has decreased throughout Kansas, the disparities have not. And so thus we must take action to address these issues. Next slide. Whenever there is a problem, there is always a solution, which is why we're joined today by many of the experts and champions in this area. But one of the reasons we are joined is because of the great work in Kansas that has been done to really bring together collaboratives to address this issue. So when we think about the Kansas Birth Equity Network, we are really rooted in community. Our collaboration started with the Divine Nine chapter in Wichita, and we were able to raise awareness, develop solutions, and celebrate Black families, because the reality is we have to begin to affirm our communities. Today, we're focused on a community-centered network. We have members across Kansas and the Missouri area, which is the Kansas City metro areas. We have very diverse members. We center Black families. We center space for collaboration and safe space for discussions. And we celebrate Black babies and families through our Black Baby Photo Contest. And we develop solutions as a collective that improve the health of Black families. Next slide. Our approach has been in community as the center, research, sharing of knowledge, advocacy, and power. But what is most important about our approach is that our definition for birth equity is shifting the focus from blaming Black mothers and birthing people for their outcomes to holding systems accountable, demanding policies and programs, and reparative action that acknowledges and heals historical trauma. We must begin to change how we present the data and how we present the problem. And we must begin to shift that blame from the individual to the systems of accountability. Next slide. So in KBEN, we focus on research. Our research agenda initially was to define our roadmap, which is why we're here today, defining a new roadmap or expanding that roadmap. But our initial plan was really to develop a roadmap of how we would do this work over the next 5 years. And for that, we developed a research agenda and a solutions list to our community because they do not do research. But our research agenda was really centered around hypertension and preeclampsia, prenatal care, maternal mental health, healthcare systems, policy, and advocacy, to really center that we needed to address maternal morbidity and mortality, infant mortality and morbidity, and paternal health as a whole within systems and outside of systems. Next slide, please. So with KBEN, we were also focusing on capacity building. If you're familiar with this type of work, birth equity work is usually done in under-resourced organizations. Small grassroots organizations usually do most of the work when it comes to birth equity. And so as a network, we wanted to build capacity and make sure that we were funding projects that came from the community and centered the community. So we did this through many grants to really focus on male postpartum mental health, washing of clothes, which is one of the disparities that we did not think about, or one of the needs, and then perinatal mental health, which is really our main cause of maternal mortality in the United States and in Kansas. Next slide. For knowledge, we know that coming to the table to do this work, we must have a readiness assessment. So we were the first to develop a birth equity training in collaboration with our community members, specifically our Divine Nine board members, and to really launch that training so that when you come to the table to create solutions for Black maternal, paternal, and infant health, that you actually are ready to create those solutions. We all come to the table with the same knowledge about this solution. And therefore, each one of our members and the community and others who are birth workers within the Kansas community are offered the opportunity to take our birth equity training, which is really focused on anti-racism, but really addresses how we do that through community engagement, uplifting the voices of Black moms and dads and birthing people, and really talking about the Black postpartum experience and what respectful Black maternal care truly is. Next slide. Equity in healthcare. So the realities of this work is that when the Kansas Birth Equity Network decided to do this work, we really thought we were going to be focused on the community. But throughout our community, we continued to hear that patients were not seen, heard, or listened to within our healthcare system. So we knew that we needed to do work on equity in healthcare. And so the Kansas Birth Equity Network holds a fellowship program called the Birth Equity Clinical Scholars Training Program, which is really for KUMC OBGYN OBGYN and family medicine residents. And it is really a program in place to teach them how to provide equitable, cultural, appropriate care to Black communities. So these residents who are already physicians are provided an additional training to really learn about birth equity, to learn about policy, to learn about grassroots organizations and experience some time working with these organizations to really learn about the communities that they are going to serve, as well as focusing on a research project that would answer one of the emerging questions around maternal and child health. Within the four walls of the system, we also must make change to make sure that there is equity in healthcare, and that's why KBEN not only centers the community, but also centers those who provide healthcare to the community. And this program has been expanded to emergency medicine. It's also been expanded to pediatrics and nursing to really impact all of those who have some value, who take some time to really care for our moms, our dads, our birthing people, and our infants. Next slide. We do advocacy, empower, and equity. So the only way to truly make change for the population is to really focus on advocacy, power, and equity, and policy change. So we've worked with our partners to really focus on a omnibus bill as well as paid family leave. And so we're really working to make sure that we change how policy is impacting our community. Next slide. For fathers, so 1 in 10 fathers suffer from postpartum anxiety or depression, but there is no P in MCH. So KBEN is really working hard to put the P in MCH so that it is maternal, paternal, and child health. And we are including the fathers. How are we doing that? Through barbershop initiatives to really have conversations, authentic, intentional conversations around perinatal mental health and the experiences of being a father. But most importantly, to change the stereotype that is in the community, where we begin to affirm our fathers' presence and their participation. A study by the CDC found that Black fathers were 40% more likely to participate in their children's lives than any other race of fathers. And thus, we want to change that from de-emphasizing our Black fathers and stereotyping them to affirming them and acknowledging their presence. Next slide.
Thank you, Dr. Smith. And thank you, Dr. Scott, for encouraging us to use our radical imaginations. Dr. Smith, for allowing us for this information so we can move forward in the community. So let's change our dynamic to talk about the community. We're going to now have Michelle Edson, who is the project director of the CCH project, to talk more about the community with us.
Thank you so much, DeAndrea. It's great to be here. And again, I'm so excited to be here in the space with all of you from Kansas. You have such a great champion who is so powerful and passionate in Dr. Smith. So I'm just so excited to work with KBEN on this project. But, you know, I want to go to the next slide and go back to this vision statement that Dr. Scott mentioned earlier. You know, it's all for us, it's all about thinking big, that we envision a world where every community filled with its realized power leads transformative efforts that achieve optimal health for families. That is how we get to use our radical imagination and how we approach this, right? We know that we can't do it by ourselves. Kansas is going to take that village and KBEN to help to see this happen. But what does that really mean in practice? It means that the community, through your trusted CBO, i.e. KBEN here in Kansas, is the lead architect of change. We at CCHI believe that sustainable improvements that are real and impactful in maternal and child health happen when people that are on the ground, right? The community, the residents, the maternal and child health population, other partners, when you have the authority, resources, and support to define the problems and then create the solutions for impactful change. So think about your CVO as that driving force, right? KBEN knows the community strengths, the gaps, the things that need to be pulled together. and the solutions that will truly stick. And so CCHI is here to help to amplify and provide additional support to that community expertise that is here, but definitely not to replace it. And that shift, right, in a lot of ways from being recipients of services for some of the community members to being those drivers of innovation is what thinking big is all about. And so we're not just talking about little baby steps of change. We've been doing that for a long time. What we're talking about is transformation, transformational change led by people who know the community the best. Next slide. So here, I just want to talk a little bit about our framework with CCHI. Again, it's all about communities leading collaborative efforts, and at the center of our model are two key components. It's a little small, but you have your community-based organization. For you, it is KBEN, and your community engagement coordinator, who is actually your lovely facilitator that has been transitioning us throughout this whole process, Mrs. DeAndrea Mullins, here for Kansas. To talk first about the community-based organization, think of them as the conveners and champions of the local voice, right? They bring the lived experiences, the trusted relationships, and deep understanding of the community assets, and also the challenges that the community may have. In CCHI, your organization, KBEN, really does take the lead in convening stakeholders, identifying priorities, and steering decisions for maternal and child health. They get to help to define the priorities, what to tackle first, what success looks like, using that radical imagination and how to measure impact. Then when you think about your community engagement coordinator, who's actually employed by NICHQ, but is someone who is from the community, who is there, who knows the history, who is there to support the community-based organization throughout this process. They get to amplify the leadership of the community-based organization. They serve as a connector and facilitator. They make sure that we have that rich lived experience data to share. They make the connections between clinical expertise, institutional partners, whether it's the State Perinatal Quality Collaborative, hospital systems, public health, et cetera. And so together, the DeAndrea, Ms. Mullins, and KBEN are forming a powerful partnership to support you all in Kansas in your community. They help to set the agenda and defining what success is going to look like and navigating systems, bringing technical support and removing some of the barriers. This collaborative but community-driven structure ensures that the strategies that you develop are relevant, equitable, and grounded in real community priorities, which is exactly how we'll achieve optimal health for families, moms, infants across Kansas.
Thank you, Michelle. Appreciate you telling us more about the community and how we can connect. Next, we'll have Dr. NICHQ Burse, and she is the founder and executive director of Six Dimensions, and she is a community-based organization based out of Mississippi. Dr. Burse?
Good afternoon, everyone. I'm really excited to be here and to be in community with KBEN and NICHQ. And so I'll just talk a little bit about the work that we're doing and how we're also focusing on community in CCHI. Next slide, please. And so our organization, Six Dimensions, we are based in Mississippi, and our focus is solely on improving maternal health outcomes. We have recently transitioned to nonprofit in 2023 after working in this field for so long. But our work is really driven by not just the big picture of maternal health outcomes, but our personal experiences with maternal health issues as well. So I have experienced many tragedies in my family regarding this issue, and it has been our mission to focus, shift our complete focus to improving maternal health outcomes. Next slide, please. Next slide. Okay. And I always like to highlight our team. We are a small but mighty team. And when we talk about community in this work, when we bring people on our team, it's about community. It's about what role they want to play in improving maternal health outcomes and what their commitment to this work is. And so it's not just about their credentials on paper, but it's about their passion and mission in life. And so we have, there are three of us. Asia Rush is our program manager who's been with us for about 3 years, and it's Chelsea Dorsey just joined us in May, but we also have a host of consultants that help us execute our work as well. Next slide. So our mission, our work focuses on research, training and development, outreach, as well as advocacy. But the heart of our work is we are grounded in social justice, history, and respect for culture. And one thing that we do a lot is try to take care of stories. And so being in the CCHI community is really important as we try to use what we have learned from our lived experiences and couple it with the communities that we serve to create better outcomes in clinical settings. And so we really try to not veer away from history being the crux of our work. Next slide. And so as I mentioned, we have research, training and development, as well as outreach and advocacy. Next slide. Our research now is pretty much focused on bridging the gap or ensuring that birth workers are a part of the maternal care team. And so we are really looking at what the birth worker scene looks like in Mississippi. We don't do birth worker trainings, but we feel like our role is to support and build that infrastructure and to also retain talent here in the state and make sure that our birth workers are well taken care of. We know that it can be very challenging work, and it's also thankless work at times. Just today, we finished up a convening with Mississippi and Louisiana, and we were trying to determine what the crossover is and how we can share strategies across states. And so our work focuses on ensuring that we are understanding the evolving needs. This field is changing. Our current social climate, political climate has made us have to shift in ways that may be a little more uncomfortable than we're used to. And so we're trying to make sure that we're moving in the right direction and digging our heels in on what we believe in. And that's another reason that we are really excited to be a part of this, is that radical imagination and being able to dream about what the outcomes would be. So next slide. And so our training, we do have a course that is focused, it's health and racial equity in maternal care. It is for early career professionals who are maybe in a undergraduate or doctorate program or even a master's degree program, and they are looking to build their skills. So this course focuses solely on the history of Black women in the healthcare system and some strategies that can be used in community. And then we also support birth workers by offering capacity building training. So we don't do birth worker training. I always say I am not a doula. I truly appreciate the work of doulas, but our role is really helping them to formalize into collaboratives, whether that's starting their own business. And so our trainings allow them to go through a business and online training for business development, and then they get access to technical assistance from the trainer so that they can continue to build their skills. And then the other part of that is we offer mental health therapy and services for the doulas that we serve or birth workers that we serve. And so they get access to one-on-one mental health as well as group therapy. And so that's really important to us. I was talking today, and one of the running themes is that we're all patients. And even though we do this thankless work, we don't always take the best care of ourselves. So we understand that in this improving maternal health outcomes and trying to ensure that birth workers are a part of the care team, we have to care for them as well. Next slide. And so these are some of our trainings. These are our first 2 cohorts where we piloted the program, and now it is a full program that is online. Next next slide, please. And so for our outreach work, and that's how we really remain connected to community. We know how hard this work is, but one thing that we try to focus on is making sure that we bring the joy to the work, and joy to the pregnancies and postpartum care that the families that we encounter, their experiences. We try to make sure that we bring the joy. So our biggest event is our Miles for Mamas 5K. Even if you're not running, walking, you are able to be a part of this event through our community family day. And it's just a lot of fun, but it also provides education, and it allows us to connect with families, to bring more into this network, to continue to talk about how we can make change. My other favorite program that we do is our family portraits. And toward the end of the year, around October, November, everyone's ready to get their family pictures so that they can send out their postcards to family and friends. Well, we host a family portraits day, and we partner with a photographer who sets up various scenes. And it allows the families, whether they come in pajamas, matching pajamas, or even formal wear, they get access to family portraits. And it's just a really good time. They get hot chocolate, the kids get a lot of goodies. And so this is our way of really bringing joy to the work, and making sure that families receive the joy even in the midst of this hard and changing environment. Next slide, please. And these are just pictures of all the fun that we have doing this work. And you see the babies. That's why we do it. The picture on, my far right is, you see several babies. Well, we had a project where we brought families together that got access to doulas, mental health, and stipends. We just provided a lot of wraparound support. And so we got the chance to see, we had 10 moms and 11 babies. So we had a set of twins, and just to see them grow and thrive, and to be in community with them has been really, really important. And some of them are even working in our field now of public health at our state health department. So it's exciting to not only be able to support the families in their greatest time of need, but also to usher them throughout their career if they want to make this type of work their life's work. Next slide. And so these are just pictures from our race, and you can go to the next slide. I'll round out with our advocacy work. And so much of this, we know in a state like Mississippi, policy really drives our outcomes. And we have not expanded Medicaid, and we've made some small incremental changes, but there have been some broad sweeping policy changes that have set us back quite some time. So we try to develop tools and resources to support community and personal advocacy. And so this year we did a day at the Capitol where we brought together a lot of advocates to work on issues that Black women face. Next slide. And so as we're continuing to build, we're looking at policy agenda, how we can build a policy agenda for our state. We received 3 resolutions this year for Black Maternal Health Week. And so really trying to make sure that we include policy in the work that we're doing. Next slide. And internationally, our team member Asia is traveling to Ghana this year to learn about the birthing culture there, the work there, but she's also going there to serve. So she'll be doing a community baby shower, and also interacting with the healthcare system to really bring practices back here, but also share her knowledge that from the work that we do here. Next slide. And so why this? Why CCHI? Why now? Much of our work is about accountability. We continue to talk about the issue. We know the numbers, we know the data, we've rang the alarm so many times, but what does accountability look like, and who are we being accountable to? And so this is also about trusting community to do what we know to do. And when I say we, I'm including myself in community as a Black woman who works with other Black women who experience grim maternal health outcomes, and also collaboration. The only way that we're able to do this work, and the only way that we're able to be successful, is to collaborate, not just with other organizations, but with community. And our main focus for this whole initiative is to be able to center the voices and experience of the families that we serve, and merge that with what is happening on the clinical side so that we can drive the outcomes and policies, and also hold systems accountable for the way that they work with our families. And that is all I have. I think next slide is our contact slide. Yes.
Thank you, Dr. Verse. Wow. Just wow. Way to do what you're doing in the community of Mississippi. And like you said, we need collaboration. So thank you for that. Next, we'll have Dr. Stacy Scott to tell us more about the OCPIM initiative in Ohio.
Okay, everybody, I am doing double duty a little bit. I serve as, well, I was one of the co-chairs for the Ohio Collaborative Prevent Infant Mortality. And I want to just give you some background about this and really let you know that this town hall meeting is really kind of from a framework that we have established in Ohio. So if we can go to the next slide, please. So when we're looking at the Ohio Collaborative to Prevent Infant Mortality, right now we have about over 800 people on roll. And this was a collaborative that was created by the previous governor in the state of Ohio and has been around probably about 12, 13 years now, give or take. And the vision of the, as we refer to it as OCPIN, is called Working Together to Eliminate Infant Mortality in Ohio. Our mission is to eliminate preventable infant mortality, improve the health of all women and birthing persons of childbearing age throughout the state of Ohio, through the sharing of the best practices in community engagement and advocacy. So we can go to the next slide, please. And so who are we? We are the members of OCPIN include stakeholder organizations from throughout Ohio that desire to work together on behalf of a common goal to eliminate infant mortality through intervention based on available evidence and informed by high quality data. We do our membership recruitment is ongoing. We aim to again establish diverse partnership with particular emphasis on non-traditional community level organizations that can provide a critical perspective on our activities as we work to achieve equity in Ohio's birth outcomes. Next slide, please. And so again, one of our big purpose and what we build our whole framework on at OCPIN is really looking at this platform of authentic community engagement, exchange of best practices, data management, and advocacy. And we really look at what our success would be is our hope to, again, improve birth outcomes, to look at reducing infant mortality, looking at areas around preterm birth, sleep-related infant deaths, and of course, congenital malformations, all that impact infant mortality. Next slide. And so what do I say? What do? We have a series of town hall meetings that you will see about a little bit in a minute, but we really again come together to exchange novel interventions and practice design to improve birth outcomes. We optimize the collection and analysis and dissemination of data. We rely heavily on looking at the data across our state. We also engage in communities to support those most at risk that experience direct consequences of infant death and also suboptimal birth outcomes. And we advocate for legislation and policy to optimize women's health, improve birth outcomes, and eliminate preventable infant mortality. Next slide, please. And so here you see the state of Ohio here. And what we have done since 2018, we broke the state out into regions. And so here is an example of what, well, actually see how our regions are broke up. Ohio has a lot of rural areas. And so what we did is we had someone to look at this particular map and really try to look at it based on infant mortality rates and all. It was a lot that went into that, much more than I can as far as looking at doing that. But Again, this is what we came up with a map, is how we broke the counties up. And so this has had been in existence since 2018. And in this last year and a half, we have really concentrated on the really regionalization of OCPEN. Next slide. And so I know I'm going back to 2022, but for us, it was a profound year on what we've been able to accomplish, and just wanted to show this as some examples as you look at you develop your particular state and what things you might be able to do. So next slide. So as I said, the way OCPEN operates is that we have 4 state town hall meetings a year, one each quarter. And this is just letting you know how we did them between, again, March, June, September, and November. We can go to the next slide. Our webinars usually are on Fridays. They run from 10 to noon, 2 hours. And here's just some examples of some of the subject matters that we've had. Before COVID, we did try to have 2 face-to-face different parts of the state and 2 virtual, understanding a lot of people can't travel. Unfortunately, with COVID, they all became virtual, and we are slowly moving back to see, can we now look at being able to at least do 1 or 2 a year face-to-face. The different regions actually host the in-person webinar. Our next slide, please. Here's another example of what we have done around our town hall meetings. Again, looking at this one was advancing equity and how Ohio communities can use data to develop solutions and shift power. Next slide, please. And again, here's another one. We actually looked at the impact of infant loss, recognizing uniqueness of grief and trauma. We bring in guest speakers to come in and to talk to us about these certain matters. We also encourage the regions to, again, join in a discussion around whatever that topic might be. Next slide. And so one big thing for us that really turned the corner for us in 2022 is that we got a grant from our state of $250,000, which really worked to support our vision and to expand our capacity. We were able to do such things as sponsor and facilitate community workshops, training and convenings and activities, implementations of community change agents to increase community member participation and engagement. Our change agents were great. We were able to provide a small stipend for them. They worked for about 6 months, and we were able to recruit and build membership for OCPEN. Next slide. And so again, what our project's objectives at that time was to create an equal voice of power for all members of the community, acknowledge the history of racism as a foundational concept, sustain conversation and engagement to establish trust and progress, affirm the community leaders are not substitutes for community members, and employ meaningful strategies to understand state of community, incorporate clear accountability and share understanding around outcomes, and support and facilitate continuous process community engagement that must include strategy for capacity and building sustainability. It's a mouthful there. Next slide. And so we were able to do a lot of things. One of the big things I talked about, our change agents, we did community lunch and learns. Were able to provide many grants that we call fire starter grants that provided a small amount of money to small community-based organizations. The first round we only provided funding to community organizations that had less than $50,000 budget. So if you were over 50,000, you did not qualify for this money. We wanted to make sure that we were doing serious, authentic community-based organizations and providing organizations who never have the opportunity to get funding to get it. We also, again, conducted statewide events. Next slide. And so here again, in each region had community events. We had safety baby showers, a partner engagement, baby safety tailgate events, and a whole host of other things. Next slide. And so the big thing that we've done, and over the years, we have what we called our big summit. Prior to COVID, We would have them every 2 years. The last one that was face to face was in Cincinnati. We had over 1,000 people in attendance. We had buses coming in from all over the state that would bring people in from the communities to come and spend that day with us around this event. We brought in some real high level keynote speakers. We had workshop opportunities, posters, and things of that nature. Of course, after COVID, we got a slow start and we are slowly picking this back up again. But what we decided to do in 2022 is to have a hybrid. We did both virtual and also in person. We live cast the virtual session from all 5 regions. All 5 regions had a location where people could come to, and we were able to do lunch, and they had workshops in the afternoon. During the day, we live cast that, given an opportunity. If we needed to pivot at that particular time because of the COVID scare, we were able to do that and take it all virtual if we needed to. Next slide. And finally, one of our big things that day, we were able to have our keynote speaker. On that Saturday morning, we had part 2 of our conference. The slide before, all that took place on Friday. Here on that Saturday morning, we were able to have Linda Villarosa, who was the keynote speaker. That session lasted from 9 to noon. And again, it was another opportunity to be able to bring the community together. Next slide. And so as we wind down and look at our spotlight for this year, we are now 2025, and I just want to go finish. I got last 2 slides, and then I'll turn it back over to Ms. Mullins over here. So if you go to the next slide. So what we are doing now, you've heard a couple of people mention about what our, social context of what we're doing and the work that we're doing and our political climate. So this was our last webinar, and we actually had a speaker from Kansas who really talked about looking at equity and what equity meant, and equity not being illegal, and all of those host of things. If you can go to the next slide. And what we did, just wanted to show you that we have a 15-member Ocpan Leadership Council. And this is just some of the representatives on our council. We have 3 members from each region who actually come in and provide discussion support in regards to certain things. And next slide. And so this is just an example of some of the questions that we present at our town hall meetings that people have when we have this discussion, and our leadership council actually leads that. So with that, I think this is the end. Next slide. And so again, we are looking at communities in action. One more slide, next slide. And if that, our journey continues. So I will turn it back over to Ms. Mullins. And I believe, am I supposed to hand it off to Dr. Smith? Okay, go ahead, Dr. Smith.
Thank you so much, Dr. Scott, for setting the groundwork for where we're going. As KBEN is growing, you may be asking yourself, what are the next steps? And this call to action will help us shape what the future of KBEN will be, or how we're expanding our work. So for far too long, Black mothers, fathers, and infants in Kansas have carried the silent weight of systemic neglect. The pain often dismissed, their resilience taken for granted, and their loss too often not acknowledged. Today, we declare with our partners from NICHQ, unseen, unheard, and undervalued no more. We today will begin to work in advancing Black maternal, paternal, and infant health in Kansas. We named this crisis with clarity. Black families in Kansas are more likely to experience severe maternal morbidity and mortality. Nearly half of Kansas counties are maternity deserts, and Kansas has begun and has continued to not acknowledge the preventable losses that we have began to turn a deaf ear and continue to do that, of the pain that is ignored, and from crushing weights of being unheard in systems that have often failed many of those who look like me. But acknowledgement is not enough. We must move beyond silence, beyond fragmented efforts, and toward collective intentional change. So our next step It's to call for capacity building and resource sharing. It's to call for culturally grounded and community-centered research, community-centered and led solutions, affirmations of communities, community-led care models that includes doulas, midwives, and medical healthcare advocates and partners and family members. Accountability through data equity to make sure that we're not just looking at numbers, but we're looking at lived experience. Policy reforms, structural and systems change to acknowledge the hurt and harm that has been caused to Black families and to change that by bringing together representation. So that means that when you go to the doctor, that a lot of them look like you. Healing and restoration, acknowledging that past harm, confronting the bias and racism, and transforming Kansas into a state where all mothers, fathers, and babies feel safe, protected, and heard. The Kansas Community Collaborative to Prevent Infant Mortality Collaborative will be for Black mothers, Black fathers, and infants, and is more than an initiative. It is a movement of accountability and affirmation. Unseen No More means Kansas will no longer discuss data without lived experiences of Black families. We will honor the grief and trauma caused by preventable death and systemic racism, and we will affirm Black families, which means Black parents and infants will be protected, supported, and celebrated, and no longer forced to prove their humanity to receive equitable care. So we invite you to join us. The time is now. Kansas has a choice. Continue the cycle of invisibility or build a future where all Black families are safe, sacred, and celebrated. We choose justice. We choose equity. We choose life. Unseen No More means that we choose acknowledgement and affirmation. So we invite you to join us today on these new efforts as we move forward. Next slide, please. Our upcoming initiative is that KBEN, if you are interested in this work as we move forward, KBEN has a new members meeting, and you can join us by emailing kbn@kumc.edu, and that is on July 31st. We also have a network meeting, and most importantly, we have a Birth Equity Summit that is in collaboration with the Heartland Conference, and I believe Dr. Todd Moore is on the call. Dr. Todd Moore and Aloma Obi are the leaders of this initiative, and we are so grateful that they sponsor us each year to bring awareness to birth equity in our state, to walk in solidarity for birth justice on the amazing baseball field, and to just share the initiative. And this year we're focusing on paternal health. So you want to come and talk about paternal anxiety and depression, co-parenting, and learn more about the expansion of the Kansas Birth Equity Network and including this collaborative. September 11th through 12th, but you are welcome to join the conference on the 10th. Next slide. I want to just acknowledge a great team. This work is not done by myself. It is actually often led by Aloma Obi, who's on our team, Shay Roy, Brianna Wells, Deja Jones, Claire Metcalf. Our community leadership, Sapphire and Joy, are amazing and keep us accountable. And our Father's Engagement, Reverend Tony Carter runs our barbershop initiative and keeps us accountable for paternal health and the acknowledgement of fathers. And Cal Ellison works closely with us to make sure that we acknowledge the father's role in KBEN. So join our network, follow us on social media, join us for the Birth Equity Summit in September. If you missed the Birth Equity Summit, you have missed a lot for the year. So you want to be in that place, and you want to join the entire Heartland Conference focused on equity for our region. Thank you so much.
Thank you, Dr. Smith. Thank you, Dr. Scott and Dr. Burst, Michelle Edson. Thank you all for joining us today. We have a few more minutes. If anyone would like to have any questions that we can answer for you all, please utilize the question and answer box down at the bottom if you need that, or feel free to raise your hand. Next slide. Thank you, everyone. Well, there is a survey in the chat that we're asking everyone if you can have opportunity to take that survey at the end of this webinar. Once again, we are here together to collaborative for the community to move forward. We also have a QR code right here for you to scan. We would love to hear your feedback. Thank you all again.
Thank you, Ms. Mullins, for a wonderful facilitation today. We appreciate you
Absolutely. Thank you so much.
so much.
And
Thank you.
special thanks to the NICHQ team for choosing Kansas.
And thank you for agreeing to be our partner. Since we're doing all the accolades. And yeah, thank you. And thank everybody for joining us today, and stay tuned.
Yes, thank you. And stay tuned.
Okay, then. Thank you.